As the world moves to recover fully from the impact of the COVID-19 outbreak, attention has now shifted to economic recovery, boosting private sector development, the health sector being part of it, in order to curb the spread of COVID-19. The government of Nigeria and the United Nations through Unido, UN Women, WHO, ILO have strengthened the capacity of selected local MSMEs and manufacturers, including women and youth-led businesses, to locally produce required quality PPEs and healthcare products based on international standards and regulations. The project, strengthening the capacity of MSMEs for the production of high-quality PPEs and healthcare-related products, funded by the European Union within its support to the Basket Fund program in cooperation with the Nigerian government, couldn't have been implemented at a more appropriate time. Since its inception, 162 MSMEs have benefited and are benefiting from this integrated and coordinated technical and training assistance provided by 4 partner UN agencies, with the United Nations Industrial Development Organization, Unido, as project coordinators, fostering national and regional markets. So far, 125 MSMEs out of the 162 are benefiting through Unido and the collaborating agencies from the supply of more than 350 equipment items such as alcohol meters, filling machines, sewing machines, mixing machines, etc. to improve production efficiency and quality for the production of face masks, sanitizers, aprons, medical scrubs, and other products. Also, Unido has given its support to the Standards Organization of Nigeria, SON, through the provision of state-of-the-art equipment as well as trainings to perform quality tests and issue product certification of PPEs according to regional and international standards. Feedback from the beneficiaries. Bukola Adeogun.
So far, I've learned a lot. I learned where we have our financial education training. They kind of made me realize I've been doing my business wrongly because it happened that I've not been consistent with my accounting.
Makinde Mudupe.
So far for me, it was well detailed and impactful. It was impactful in the sense that it improved my business in form of online marketing and recording of financial transactions of my day-to-day business activities through online marketing, by creating my own Instagram business accounts and Facebook business accounts.
Jude Onya.
We are supplying to pharmacies and schools to help curb the spread of COVID-19 pandemic. During that period, UN Women, WHO, Unido and ILO became involved with us, and they helped us in teaching us, in training us, and in helping us in a lot of things, and partnering with us. And what they taught us in their training school is helping us in improving our products, in making our products standard, in making service and marketing okay.
Shokunle Adebayo Benjamin.
Let me first appreciate Unido, ILO, UN, Women and WHO for this training. It gave me an insight on how to improve our distribution, how to reach out to our customer. And we are made to understand the value proposition of this hand sanitizer so that we can get more customers and how we can reach out to them. And I'm looking forward for more customers for the business, and which is an added value for the company. So we are very grateful for them.
Olabode Ekundayo.
With regards to the training sessions from Unido, ILO, UN Women and WHO, the training session has been actually quite impactful to our operations. On the technical side, it has had tremendous impact on our quality management system. It has helped to improve it, and also our manufacturing processes. Part of the training that we enjoyed really helped to improve our manufacturing processes. So it's been very good.
On July 5th, 2022, the project had its first awareness-raising event, graced by various stakeholders across the government and non-governmental organizations, sailing into the next phase of this project. Jal Hanstein, the Chief Technical Advisor to Unido.
One of the, let's say, a prerequisite, and this is consistent, with policies everywhere, to focus and to enhance the capacity of women and youth. This is again considered with EU policies, but of other donors as well. So there was a certain criteria were set up: 30% of women-run businesses, 20% youth-run. We have exceeded this percentage. 50-60%, which is, I think, quite important.
Speech from Mr. Bakole, Unido Regional Director and Representative to ECOWAS.
We have a number of projects in Nigeria which are strengthening the capacity of the SMEs. For example, and maybe we'll speak about it in another conversation. For example, we have the, a project named Strengthening the Capacities of the MSMEs and Manufacturers on health products and mainly on the personal protective equipment, in short, PPEs. You know, this project has been designed to support the multi-sectoral response of the government in the context of the COVID. What are we doing to be prepared ourselves in terms of manufacturing these health products locally? What are we doing to really try to increase the productivity? And those SMEs who are engaged in this production, what are we doing to provide with them the necessary support to improve the quality? Because when it comes to the health sector, one of the requirements is the quality in order to ensure that these products are not going to have a negative effect on our health. We cannot move ahead without the ownership of the activity by the government. I would like to raise here a very important achievement, mainly linked to our policy dialogue. As I said before, Unido is promoting the cooperation with the government of Nigeria through what we call the country program.
This is a pilot project which is expected to constitute and introduce a methodological reference model for other MSMEs operating also in other manufacture sectors. Without a doubt, this project is set to unleash the next set of experts in business, focusing on the socio-economic aspects and objectives to enhance the quality of COVID control, especially in the area of PPE production in view of possible other outbreaks in the future and for other purposes in the health sector in general.